Okay, this lecture will focus on white blood cells, also known as leukocytes. We'll need to be able to talk about the structure and function of each type of white blood cell. We need to be able to pick them out. Looking at just their picture, we'll look at the formation and the life history, and then also some disorders. So the white blood cell is the least abundant formed element. It only composes 1% of the hemocrit. We would expect to see anywhere from 5,000 to 10,000 white blood cells per microliter of blood. They protect against infectious microorganisms, any other invading foreign matter, if you want to call it that way. We can tell them by their weird-looking nucleus, and you'll see what I mean when we get to pictures. Conspicuous is a funny word, but they definitely have nuclei that look different than any other type of cell. They only spend a few hours in the bloodstream before they migrate to the connective tissue, and that also depends on the different type of white blood cell that we're talking about. They do retain their organelles for protein synthesis, so unlike red blood cells, they have all of the organelles, they are producing proteins, and again, that's going to differentiate depending on the type of white blood cell. They are broken up into two groups based on the appearance of granules. The granules, when we look at the picture, are going to look like dots, but they are from lysosomes that make these granules. They are in the cytoplasm, and if we see them, that means that they are considered granulocytes. And those types of granules have enzymes more focused on defense against pathogens. So that's how we're going to first break into two categories of leukocytes, granulocytes and agranulocytes. Again, granulocytes, we are going to see those granules. They look like dots in the cytoplasm. On your slides, they should look purple. And so that's how we are going to divide into two categories. But then each of those categories has multiple types of white blood cells. So let's look at the granulocytes first. They are all going to look almost polka dotted when we see them under the microscope. The neutrophils have barely visible granules. We don't see the dots as clearly as in the other two types of granulocytes, but they do have a 3 to 5 lobed nucleus. Now, this may look like 3 or 5 nuclei because the links between the lobes might not be able to see them on your cell. So they may look like it has more than one nuclei. These are the most abundant type of white blood cell, making up 60 to 70%. The next are the eosinophils. They are much smaller in number. They only are 2 to 4% of the white blood cells. They have large rosy orange granules. Now, I can't guarantee that yours are going to be rosy orange, but the granules are much larger. And then they also have a bilobed nucleus. That means a nucleus that has two lobes. Sometimes it's called a horseshoe shape, but you might not be able to see the link between the two lobes. So just like in the neutrophils, it may look like there's two nuclei. The basophils are the last type of granulocytes, less than 1%. They have large granules. They almost take up the whole cell. We might not be able to see the nuclei. It is a large S-shaped nucleus, but those granules get so big and kind of take over that you might not be able to see the nucleus at all. And then the two types of agranulocytes are lymphocytes, which are making up 25 to 30%. They have bluish cytoplasm, and they have a uniform, round, dark nucleus. Then the monocytes are the largest white blood cell, but they only make up 3 to 8%. And they do have, again, a horseshoe-shaped nucleus. Now, they will look different than the eosinophils, and we'll see those differences on pictures coming up in just a minute. So, looking closer at the functions of each type of granulocyte, the neutrophils are increased numbers in bacterial infections because their job is to destroy the bacteria by phagocytosis. Eosinophils, we see those in increased numbers during a parasitic infection. We also might expect them to see more of them during allergies or diseases of the spleen or the central nervous system. They are also doing phagocytosis, but of those antigen antibody complexes and allergens. They do release enzymes to destroy large parasites within the body. And then the basophils, we would expect to see more of them during chickenpox, sinusitis, or diabetes. They do secrete histamine, which dilates our vessels to speed up blood flow. And then they also secrete heparin, which promotes the movement of those white blood cells, or the movement of white blood cells in that specific area. And there they are. So the first picture on the left is the neutrophil. Again, it is lobed, but it kind of doesn't look like that to me because you can't really see those passageways in between the lobes. So 3 to 5 lobes of the nucleus. Then the middle is the eosinophil. Sometimes it kind of looks like a dumbbell type of nucleus. So you can kind of see that little passageway in between the 2 lobes of the nuclei. But again, not always. So sometimes it looks like there's 2 nuclei. And then the basophil, see what I mean about the granules kind of taking over. You can't even really see anything because the granules are so large. On to the A granulocytes, the lymphocytes. We're going to be seeing more of them during all types of infections and immune responses. Really, they are those immune cells because they are able to destroy other types of cells that are foreign. So potentially cancer cells, foreign cells, or any cell that is infected by a virus. They coordinate the actions of other immune cells, and they secrete antibodies for immune memory, just like we talked about in the last video about the Rh factor in pregnancy. So of the A granulocytes, the last one is monocytes. They are increased in numbers during viral infections. They leave the bloodstream, and then they transform into macrophages. Those are specifically the cells that use phagocytosis on pathogens and debris. So that is their main job. And there they are. Left-hand side is the lymphocyte. The nucleus pretty much takes up the entire cell. And then the right side is that horseshoe-shaped nucleus of the monocyte. And these, they do look a little tiny bit speckled, but not the granules that we saw on the granulocytes. So these are A granulocytes. Okay, looking at the life cycle of the blood cell, a white blood cell. Just like red blood cells, they have a little bit different of a process to be made, except there are quite a few similarities. They both start from stem cells. And here this is going into the types of intermediate cells that they become before they become their different types of leukocytes. And this is occurring in the red blood cell, or in the bone marrow. They are storing and releasing the granulocytes and monocytes. Remember, the lymphocytes are not being created in the bone marrow. Okay, our white blood cells do not stay very long in the bloodstream. So depending on the type, they are going to leave shortly and then go to the connective tissue where they are going to live longer. So granulocytes, all 3 types are going to leave the bloodstream within 8 hours, but then at the connective tissue where their destination is, they would live 5 days after that. Monocytes leave the bloodstream after 20 hours. Then they are transforming into those macrophages and can live for several years throughout the body. And then lymphocytes have a much longer lifespan. They can be cells for decades, and they are continuously recycled from the blood to the tissue, and then to the lymph, and then back to the blood. And there's the production of each type, what those intermediate precursor cells look like. I'm really not picky that you memorize the names of all those precursor cells. That's kind of a lot going on. Just realize that a blast is usually the suffix for a precursor cell. But then you should be able to identify the types of mature white blood cells. Some disorders of the white blood cells: a low white blood cell count below 5,000 white blood cells per microliter is leukopenia, and that could be caused by radiation or infectious disease or poison. And basically, if you have a low white blood cell count, you have an elevated risk of infection, which makes sense because those white blood cells are what are arriving at the scene of infection. Also, we could see leukocytosis, which is a high white blood cell count above 10,000 white blood cells per microliter. This can be caused by an infection, allergies, or other types of disease. Leukemia is probably the one that you're most familiar with. This is the cancer of the tissue that's producing too many white blood cells and those precursor cells. So the body is basically, the white blood cells are taking over and there's not enough room for red blood cells. So there's two types depending on which type of white blood cell is being overproduced. You could have acute leukemia, which appears suddenly and progresses rapidly, or chronic leukemia, which is undetected for a while, but then the survival time could be 3 years. So this is probably more common would be the chronic leukemia. The normal cell percentages are disrupted, and so if there's less red blood cells, this could impair your clotting, and of course the oxygen making its way to all of the tissues. Wanted to show you the comparison between a normal blood smear and then one of a patient with leukemia. So you can see that those white blood cells are taking over. They are way higher concentration or percentage than you would expect in a normal blood.